The authorities greatly expanded a travel lockdown in central China on Thursday, essentially penning in more than 22 million residents in an effort to contain a deadly virus that is overwhelming hospitals and fueling fears of a pandemic. The new limits, abruptly decreed ahead of the Lunar New Year holiday, China's busiest travel season, were an extraordinary step that underscored the ruling Communist Party's deepening fears about the outbreak of a little-understood coronavirus. Chinese health officials reported on Friday that there had been 26 deaths from and 830 cases of the coronavirus, a sharp increase. The official death toll increased by more than a half dozen in 24 hours, while the number of confirmed cases jumped by more than 200. On Thursday morning, the authorities imposed a travel lockdown in Wuhan, the industrial city of 11 million at the epicenter of the outbreak. Airlines cancelled hundreds of flights to Wuhan, leaving thousands of people stranded. Later in the day, officials said they would also halt public transportation in the nearby cities of Huanggang, Ezhou, Zhejiang, and Chibi, which are together home to more than 9 million residents. And by Friday, restrictions had extended to Xiantao, Qianjiang and Anqi, 3 other cities that include large rural populations. 2 deaths have been confirmed outside the virus epicenter. 1 patient died in the province of Hebei, more than 600 miles north of Wuhan after contracting the coronavirus, the provincial authorities announced on Thursday. Another death was confirmed in Heilongjiang, a province near the border with Russia more than 1,500 miles from Wuhan. The disease had also been diagnosed in patients in Vietnam, Singapore, Japan, South Korea, Taiwan, Thailand, and the United States. In Wuhan, where the outbreak began, anxiety and anger prevailed as worried residents crowded into hospitals, and teams of medical workers in hazmat suits sought to identify the infected. The virus has sickened hundreds of people in Asia and at least 1 person in the United States. Hospitals and medical workers at the center of the outbreak made urgent appeals for supplies, as stocks of surgical masks and other equipment quickly flew off shelves. Shortage of medical supplies, request help, the Wuhan Children's Hospital said Thursday in a post on Weibo, a Chinese social network. The hospital asked for donations of surgical masks, disposable garments, protective goggles and gloves. Several other hospitals, including the Hubei General Hospital, Renmin Hospital of Wuhan University and the Central Hospital of Wuhan posted similar notices. The central government on Thursday acknowledged the severe strain on resources, and the Ministry of Finance announced an urgent allocation of 1 billion renminbi, about $144 million, for epidemic prevention and control work. State news media also carried reports of people volunteering to help ease the strain on health workers. Young doctors at the Renmin Hospital of Wuhan University volunteered to take on additional shifts or to take over from colleagues with children, the state broadcaster CCTV reported. A team of 30 volunteers in Wuhan mobilized to drive doctors to and from hospitals, while others have offered to help the local Red Cross answer phone calls and publicize requests for help from hospitals, according to a report by the China Business Journal. Many infectious disease specialists say that cheap, disposable masks that cover the nose and mouth can help prevent the spread of infections if they are worn properly and used consistently. But there isn't much high-quality scientific evidence on their effectiveness outside healthcare settings, experts say. Dr. Julie Vishampayan, chairwoman of the Public Health Committee for the Infectious Diseases Society of America, said surgical masks are the last line of defense. The masks will, however, block most large respiratory droplets from other people's sneezes and coughs from entering your mouth and nose, said Dr. Amish Adalja, an infectious disease physician at the Johns Hopkins Center for Health Security. Coronaviruses are primarily spread through droplets, he said. Dr. Mark Loeb, an infectious disease specialist at McMaster University in Hamilton, Ontario, said a study during an outbreak of the SARS coronavirus found that any type of protection, whether a mask or a respirator, reduced the risk of infections in healthcare workers by about 85%. The most important message was that the risk was lower if they consistently used any mask, he said. but washing hands frequently and before eating is universally recommended. Hand sanitizer is effective against respiratory viruses. The American and British governments on Friday urged travelers to avoid the city of Wuhan and the surrounding area amid growing signs that the outbreak of the deadly coronavirus is worsening. The American embassy in Beijing advised travelers from the United States to avoid Hubei province, where Wuhan is the capital. It said the State Department had already ordered non-emergency government personnel to leave the city. It further warned that the Chinese government might prevent travelers from arriving or leaving. The notice from the State Department was a Level 4 advisory, the sternest warning the United States government issues regarding travel. Other Level 4 warnings issued by the State Department include travel to Syria, North Korea, Afghanistan, Iraq, Venezuela, and Yemen, among other places. The warning is a step up from Washington's earlier cautions. Just a day before, the American government had been advising travelers to exercise extreme caution when traveling to the Wuhan area. The British government in a notice dated Thursday similarly advised against all but essential travel to Wuhan. The warnings came as the Chinese government on Thursday began widening travel restrictions to cities surrounding Wuhan. The tougher restrictions apply to cities including Huanggang, Ezhou, Chibi, and Zhejiang, affecting millions more people. The Hubei government has imposed some of its own travel restrictions across the province. Reporting was contributed by Chris Buckley, Javier Hernandez, Vivian Wang, Austin Ramsey, Elaine Yu, Tiffany May, Russell Goldman, Jillian Wang, Paulina Villegas, Stephen Lee Myers, Denise Grady, Karen Ziraek, Ronnie Karen Rabin, Carl Zimmer, and Rick Gladstone. Amber Wang, Albi Zhang, Claire Fu, Elsie Chen, Yaiwei Wang, and Zoe Mao contributed research.